My name is Bodil Bach, former pediatric nurse. But for the last 30 years, I've been working with the development of telemedicine in Norway. From different levels, the National Center for Telemedicine in Tromsø in northern Norway, and from private industry. Now from my own company, SmartSam. In my work, I assist hospitals and municipalities with the startup of health technology in their organizations. The topic of this telemedicine course are use of video for patient treatment and follow-ups in healthcare, as an example of what's needed to establish new services using technology. The course consists of 6 presentations of 20 minutes, documentation, an overview of relevant sources, and at last a quiz after each presentation. After attending this course, you will be able to demonstrate knowledge and have an understanding of telemedicine and clinical applications. Table of contents today is some terms in use in this field. And how did Norway become a pioneer in telemedicine? How did we organize and anchor the development? There are differences from country to country. We just use this as an example. What is telemedicine and what can it be? The scope of opportunities. What does it take to introduce new services using technology? How do we get success? From the beginning, everything was named telematics anyway, and after a while telemedicine became the main concept. Then came telehealth, telehome care, when we found out we could treat patients at home as well. Welfare technology, digital home follow-ups, which contains all kinds of sensor technology. During the pandemic, we all became familiar with the concepts of video consultations. When patients could not come to the hospital, digital outpatient clinics had to be set up in all countries. Telerehabilitation are now an approved concept inside the field of rehabilitation. And today, e-health is a collective term that includes ICT application in the health service. The goal is to improve quality, safety, and efficiency healthcare through the use of information technology. It also includes private individuals' use of ICT applications for health purposes. The development of telemedicine started already in the 80s in a collaboration between the hospital in Tromsø, now named University Hospital of Northern Norway, and Telenor, which was the largest telecommunication company in Norway at that time. In 1992, Dr. Steinar Pedersen, on the picture, presented the idea of telemedicine department, which became the National Center of Expertise in Telemedicine, and Pedersen himself. He was the first manager in telemedicine and became a kind of telemedical expert all around the world. The telemedicine department was an international laboratory for telemedicine and WHO's collaborating center for telemedicine for 8 years. During the years was an international master's and PhD program in telemedicine and e-health established at the University of Tromsø as well. The next step in the story was that they started a Norwegian Center for e-health research in Tromsø in the north of the country, and Norwegian Directorate of e-health in Oslo in the south of the country in 2016 as a national overarching organization within e-health. This is an example of the organization in this field in our country, which can be seen in different forms in different countries. During the first year, some services can be mentioned. What kind of services was planned and tested at that time, and how do we use them today? Telepathology, transmission via video conferencing, today as digital image transfer inside and between hospitals for co-diagnosis and second opinion. Teleradiology, transmission of X-rays images via video conferencing It resulted in cut in response time with 3 weeks for the patients. It's a service in regular use today as digital image transfer inside and between hospitals and healthcare centers. And it can also be used as a cover-up in a lack of radiologists. Teledermatology. Patients far away can save transport to the specialist and have the consultation together with the GP and the specialist on screen. Light treatment locally, very successfully service. ENT. GP examine the patient and the specialist on screen, and together they're doing the diagnosing and agree on further treatment. Scored to be a very suitable service for dissemination. Teledialysis, mainly provided as hemodialysis in hospitals, which binds the patients 3 times a week, 5 hours, in addition to the traveling time needed. Several countries need to decentralize such treatment as much as possible. Telepsychiatry, a service with a lot of skepticism for many years, but working well with satisfied patients. Ultrasound examination of pregnant women have been tried successfully, which made the pregnant women safe during pregnancy. Echo surveys between hospitals and GPs, very well functioning on heart patients. Most of these services are not in regular use today, but distance learning, on the other hand, are come to stay. Most countries have national plans that set guidelines for the development area. In Norway, as in many countries, there have been many national guidelines, some useful, other less useful. But our last plan, however, was very concrete and says clearly about using video conferencing and other technologies. Technology can replace attendance by health personnel, GPs, home care services, specialists and more. And this is a clear goal. In connection with the overall plans, guides are often designed as detailed implementation guides. For new starters, absolutely recommended. And infrastructure is the basis of all services. The backbone of telemedicine and e-health in Norway is the Norwegian HealthNet. This computer network is, together with the electronic EHR, an underpin for telemedicine and other healthcare services. The path to the goal. I ask everyone to take note of this. There are no shortcuts to introducing safe service pathways across the primary and specialist health services. One of the challenges that needs to be solved is figuring out what can be solved with video communication and when do we have to meet the patient in-house. The collaboration requires that both technological and organizational staff work together. It's therefore important that all involved people in all affected departments are involved in the planning and implementation of the new solutions. So let's go to work. We are now ready to build new services with all players involved.